Hi guys, Jade Rainbolt here, Doctor of Physical Therapy, and today I'm going over hamstring strains. So maybe you pulled your hamstring after, a lot of times it happens after running, after sprinting, maybe you were lifting something, weight training, whatever it may be, but you pulled your hamstring, you got pain into that back part of your leg, and you want to know what to do, you want to get better. So these exercises and stretches will be good for you. I do want to emphasize, if this is a fresh pull, strain, whatever it may be, and it's real sensitive and painful at this phase, at least for the first couple days, you don't want to put a lot of stretch onto it. You don't want to be aggravating the area. I would just rest, ice it, compress it, let it rest for a couple days. Once you find yourself being able to walk without a limp, without the pain really getting to you, then it's time to get into the strengthening, rehabbing part of it. If you do it too quickly, you're just gonna aggravate it and it isn't gonna progress and get better. So let's get into them. Let's say it is my left leg that has the hamstring injury, and our hamstrings run from underneath our knee, they hook to this bottom, the top part of our lower leg, and they run all the way behind our thigh and hook all the way up at our ischial tuberosity. So it runs this whole length. So if you're someone who has a hamstring injury, you may have pain along the muscle belly. Commonly it's just along the muscle belly, but you may also get pain distally, more down here, or even up near the bottom of your butt, because that's the course that the hamstring runs. So let's say my injury is more mid-belly. Something that you can start off doing is just rubbing the area. So you can do cross-friction massage and just rub the area and try and break up some of that knotted tissue. But this also helps with getting circulation to the area and just some nice input. So rubbing the area, you don't want to push on it to the point that it really hurts, but a little bit of discomfort is fine. But if you're getting any sharp pain throughout any of these, then that's your key to back off. So you definitely want to listen to your body. But you can either do it by cross friction with your hands and just kind of rubbing the area, or you can grab your foam roller. So if I can grab it. So you can also get that leg right underneath and a foam roll. So you can control the amount of weight that you're putting onto your leg by using your arms. And even this leg. But you can foam roll that area. You can even use a massage gun. There's a lot of nice massage guns out there now, and you can just gun the area, get some nice circulation, break up the area. So you can do any sort of massage like this before or after exercises are fine. But we'll go ahead and go into our first exercise, and it's gonna be a hamstring isometric. So you're gonna lay back, and our hamstrings operate anywhere from here to straight. So we wanna activate them throughout the whole plane. So the first one's a hamstring isometric, and you're going to dig your heel into the ground. You're gonna feel that hamstring kick in, and then you're gonna relax. And you can do both of them. You can do both or single, but I would do both. You don't want to get lopsided. No, it's good to work both sides. But you'll hold it for a couple seconds and then relax. So like I mentioned earlier, if you're getting sharp pain throughout any of these, then you either want to push a little less hard or try a different position. So the closer your legs are, the easier it is. But you also want to work your way out. And it gets a little harder. And it'll feel different, similar but different, and you're just pushing into the ground. You're gonna feel those hamstrings contract. And you'll work the way. So the more force you put in, the more it gives back. So as long as those feel okay, no sharp pain, a little bit of tension is okay, then you can progress to the next one. The next one is going to be a knee extension. So you're gonna hold that leg and just kick that leg straight and back down. And you wanna keep it nice and controlled. So this is called reciprocal inhibition. So when you contract your quad on this side, it helps to turn down the activity back here, which Just helps it with dynamic lengthening. So you're stretching it, but not real aggressively. It's a friendlier stretch. You don't want to go stretching a hamstring strain if it really hurts, because you're just pulling at that inflamed tissue and it's not going to feel good. So with this, you want to go far enough that you feel a light pull, but that's it. If you go farther and it's painful, then you want to back off a little bit. So if you think of it like a forest fire, you want to put out the fire before you can rebuild. So make sure you stay out of that sharp, bad, painful area, just right before it. And a little pull's okay, just none of that sharp pain. Okay. So you guys know that I like to be, I don't like to roll around a lot. So if you can stay in one position, do a lot of things, I like that. So going right into the next one is going to be a bridge. So you start with your feet about neutral. You're going to press up, equal weight through both legs, and back down. So this also contracts your hamstring. Your hamstring is a hip extender, which is what the body's doing right now. And back down. And just like the previous one, you can work your way out, go up, bridge. With this, the further away your legs get, the harder it is. So that gets a little harder. But if you can tolerate all of these without having pain, that's good. But if you're getting pain out here, then I would go back to up here, because you don't want sharp pain throughout any of these. And then if you want to progress from a regular bridge, you can go up with both legs, down with one, up with both. So that's an eccentric hamstring motion if you want to progress from that double leg to single leg. Yeah, and I would do both sides just to keep you guys even. The next ones we're going to go into standing. There are a couple standing ones that we want to do. Okay, so the next couple are in standing, and the next one's going to be a single leg deadlift. So you're going to have something to hold on to, and this can be a foam roller or it can be a wand, something. Really, it could be anything to balance on. But again, it's this left leg that's injured. So you're going to keep balance with your right hand, and you're going to do a deadlift down. You can have about 10 to 20 degrees of flexion in that knee, and then come back up. So use that for balance. Your back leg can either go in the air or it can be lightly touching down, but you want to hinge forward and then come back up. Hinge forward and come back up. So we're just lightly putting a little bit of stretch and load on that hamstring, but we're stopping before it's painful. Or if you notice you push into a painful spot, you just go a little bit less than that and then back up. So that's a single leg deadlift. Okay, and going from there, the last one, again, you can hold on to a foam roller or just anything, but you're gonna go into a lunge, a reverse lunge, so you can hold on and go down, and that targets that hamstring as well. And that's a reverse lunge. So, if at this point you can handle all of these exercises and they aren't causing your pain, then you're ready for the next level. So if you guys found these exercises helpful, make sure to like this video and stay tuned, because I post weekly videos on staying strong, mobile, and pain-free. Catch you in the next one.